And we kind of talked about stacking and using it in clinics, combining PMF therapy with other therapies like hyperbaric, red light, cold exposure, IV, you name it. But why do you think PMF works so well alongside these other modalities?
I think it comes back to ATP. A cell can benefit from so many different things, but uh, the magnetic fields that our systems put out do travel through the body. Even the lower intensity systems do travel through the body because they're effortlessly common and natural to our body, right? We know, and for those listeners that are unfamiliar, the earth puts out a magnetic field. And that magnetic field is really critical to our body's ability to function. PEMF basically mimics that with different frequencies and different intensities, but it's so natural and so beneficial, but it does, again, something different. Red light is amazing, but it doesn't go all the way through the body. If it did, if it was behind you, that red light would shine through your front. It doesn't. That mechanical energy gets absorbed. So it will only go so deep. Um, uh, this is a little speaker that we buy on Amazon. We think spend $2 for it, and it comes connected to some wires. We actually cut the wires, and this is a speaker with no power. When people are on our system, and most PEMF systems would do this, if the magnetic field was coming out from behind me, if I would put that speaker in front of me on my sternum, the magnetic fields traveling through my body would actually make that speaker chirp.
Mhm.
So something you can't see, those magnetic fields, you can hear as they're passing through the speaker.
Mhm.
There are very few other things that actually do that actually can influence all the cells in the body. Cold and everything else that you mentioned all have their place. They're different than what PEMF is, but PEMF can help bring energy deep into the body. And that is very valuable. So if those cells now have more energy, ATP, then all of these other modalities can actually do even better. Not everything, again, can actually influence the cells that PEMF can reach.
No, it's a great point because we've got those little, we call them clickers, and they're
Yeah.
good to pick up magnetic field to show people it passing through the body. And we found some that are particularly sensitive, so we can use them on low intensity systems and show how the PMF goes through the body. But funny enough, you mentioned earlier about going to the exhibition in Austin, and you and I were on two stands, far enough away, but close enough maybe just to throw, a stone to each other. But the funny thing is, we're using these clickers and we're actually picking up pulses, magnetic field, and same vice versa. You're probably picking up some of ours. But it just shows you the range of these devices, especially in the high intensity range. We wasn't expecting to see such a big magnetic field coming from them. But it shows you that it's going through body, it's going through everything that's in that area. And that's why, PMFs originally very, very early on were used for telecommunication purposes, and still are in the higher frequencies.
Right.
Um, but when we stack these two, when we stack PMF therapy with other modalities, I know it depends on the modality, but if you had to say one, is there a particular place generally where you would put PMF? So would it be before, during, or after those modalities when PMF is most effective and recommended to do?
Yeah, I would put PEMF first. I think it's still valuable if you put it, second, third. But if you put it first, the benefits that you can get are so fast. So putting the energy where your body actually needs it first then allows these other modalities, these other technologies to start working with cells that are already better conditioned, better
Mhm.
primed to, optimize whatever those technologies do. So I would recommend it to be first. If it's done second, third, you'll still get benefit, but first I consider PEMF to be so foundational to what our cells need to perform and to do their function that first always seems to be what makes the most sense.
Yeah, and when 100% agree with that. I think it's it's almost preparing. Well, it is preparing the cell for the next modality, and if you're getting people that are using hyperbaric and they're just not getting the results that everyone else is getting, try putting PMF therapy before, getting the cells ready to adapt and to take on that extra oxygen, and then see what happens. And a lot of the time, it's like mind blown moment. Suddenly they're getting results off the HBOT. Talking about clinics, the you mentioned about passive therapy, PMF being a passive therapy. So just quickly explain what that means to someone and how important is that for busy clinics?
Sure. Passive therapy, meaning all you need to do is just sit somewhere, lay
Mm,
somewhere. If you're laying on your equipment, our equipment, and that magnetic field is actually just traveling through your body, you don't need to do anything. You're just, able to sit, relax, watch TV, do whatever you choose to do. There's nothing that you need to be expert about, trained about. And because the systems are so safe, in many cases, people that will use our system, they know how to put themselves on it. So it
mm,
doesn't require someone that works at the clinic to put them on. You don't need to take clothing off. You don't need gels. You just sit down, or you just put one of the pads or applicators on the part of the body where you need it. And then you could start using the machine. So it is very easy to use within a clinic or a home environment. It's something that people, and this is maybe where high intensity does have a different uh, feeling. If someone were turning the system up with a high intensity system and it got to be too much, you just stop turning it up, you turn it down.
mm.
So it doesn't force you into a range or feeling that you don't like. So it's a very intuitive type of application for those people that haven't tried it yet.
Mhm. And high intensity is traditionally known as a professional system. So a lot of people will start looking at PMF and they see high intensity PMF put into the professional grade, clinic grade, more so than the lower intensity systems. But we're actually seeing a huge rise in people buying these systems for their homes now. Um, why do you think that's happening?
I think the biohacking community
Mm,
is doing a lot to educate people, including doctors and others, that these types of technologies are out there. I think when people have the opportunity to try systems like yours and ours, they feel something and they know that it's something that can be beneficial to them. And for some people that are dealing with chronic pain, um, their options aren't always the best if you're considering surgeries or drugs that they have to potentially take for the rest of their lives. So when they can find an option that is natural and non-invasive, and it can lead to an improvement that allows them to function, the investment, and I'll come back to that word, is really something that people are very often willing to make. We used to say, buying a system like the Pulse PMF system, it's kind of like buying a car. Cars have gotten so expensive that we have to find something else to compare it to. But it is still expensive. But people, I believe, do care about continuing a lifestyle. I think we sometimes use the term lifespan. Um, how can people actually remain productive, not just live longer, but
mm,
live longer being able to play tennis, play pickleball, play golf, pick up children and grandchildren is so important to them. And that's why, I mentioned the fingers being so important. When people start to lose the ability to do the things that they value, they start really recognizing the need to find a solution. And in some cases, that's investing in the types of things that can actually bring them back to a place to do those things that they care about.
mhm. And just approaching them too differently, like, do you think there's a difference between how clinics and home users approach treatment at all?
I think there is, and I think it ties to the luxury of time. The home user has the ability to pick the settings that they like that, again, tied to how much time they have available, where a clinic is limited. A treatment session is a certain duration, and if somebody wants it, they've got to book a second. So I do believe clinics will use a system like pulses to really fit into the time allotments that they provide for the treatment for that client or the patient in a doctor's office. So we certainly see some doctors that will use the pulse system for as little as 20 minutes. We sometimes want to push them to try to use it a little bit longer, but because of the additional power, they can actually see benefits in those shorter windows.